Hi, my name is Dr. Dawn Babish. I'm the Canada Research Chair in Aging and Immunity and a professor at McMaster University. I'm also a COVID researcher. Today I'm going to tell you a little bit about some new and emerging data that affects how we treat our back to school in September 2021. Is returning to school in 2021 different than in 2020? Well, yes, and the primary consideration here is that the variant of concern that is circulating in Canada now is the Delta variant. Some of the features of this virus and how it interacts with those of us who've been vaccinated have changed compared to the original variant, and this might change some of our thinking and some of our considerations for how to keep schools safe. There is considerable debate about whether schools are a site of transmission. Some scientists believe that children bring the virus to school, but they don't spread it within the school. Others think that schools are a site of spread. But no matter what side of that debate you land on, we can all agree that there's a lot more COVID circulating in our community this year than there was last year. There will be more COVID in our schools because there's more COVID in our community. Whether it spreads in school will depend in part by some of the decisions we make about how to keep schools safe. For those of you who are visual learners, this is what the Canadian provinces and territories look like this time last year, with the darker colors being more COVID. And this is what they look like this year. So again, lots more COVID in our communities, and that means there will be more COVID in our schools. Today I'm going to talk a little bit about how we can sort of help stop that spread and what we can expect with these increased rates. So a year ago, we were dealing with the original COVID variant and maybe some of the less transmissible variants. We knew that it was a contagious virus, and we expected that most people had the capacity to spread it to 2 or 3 people. The Delta variant, which is now the major variant in Canada, is extremely contagious. One person can infect 6 to 9 others. And if we compare this to other viruses, the influenza virus, where one person generally only gives it to one or slightly more than one person, the common cold virus gives it to 2 or 3, respiratory syncytial virus, which often infects one person, infects 2 to 3 others, the highly contagious chickenpox, or the incredibly contagious measles virus, we see that the original version was sort of like a common cold virus, and the Delta variant is far more contagious. This changes a lot of the math about what we need to do to keep communities and schools safe. Another major feature is that all of us who were vaccinated against the original strain. And when we generated an immune response to that original strain, it was what we call effectively a sterilizing immune response, meaning that we would not carry in any meaningful way that virus, or we would be sterilized to that virus. We now know that the Delta variant can still be carried by people, even people who are fully vaccinated. They carry less of it, they carry it for a shorter period of time, but they can still carry it. And this really does change a lot of our thinking, because if you have sterilizing immunity, it means you can get what we call herd immunity. You can stop the virus from spreading in communities by having a certain proportion of the population vaccinated. If vaccinated people carry the virus, even at a lower dose, it's not entirely possible to be protected just because the people around you are vaccinated. Let me show you what this means. So here we've got an example of the measles virus, which, like I said, is highly, highly contagious. Each dot here is a person, and none of them are vaccinated. As soon as that measles gets into our community, well, they can now infect 12 other people. Each of those 12 people can infect 12 people, and you can see that the virus spreads pretty much unstopped through this community. Now here we've got 50% of the people vaccinated, which sounds pretty good. Unfortunately, that means that about 6 of them can be infected. Each of those 6 can infect 6, and again, we get rapid spread through the community. So for a highly contagious virus like measles, we really need to have 99% of the population vaccinated, so that this person in the bottom right-hand corner here is protected by a wall of vaccinated people. And in fact, what we see for measles is that there are pockets of unvaccinated people. So people who might choose to be unvaccinated are often surrounded by friends and family who are also unvaccinated. So we tend to see that there are these these infections in pockets of people. But again, with the broader immunization in the community, this person over here who perhaps couldn't or wasn't vaccinated might still be protected. Let's compare this with the Delta variant. So let's take the lower end of the contagious spectrum and assume that this one person can then infect about 6 other people. Well, those 6 people can infect 6 people who can infect 6 people who can infect 6 people. So sure, it's a little bit slower than the spread of measles, but obviously, as we're seeing in our real and lived lives, we can see lots and lots of spread of this infection. Let's say we have 50% of the population vaccinated. So this person, the original person, infects maybe 2, maybe 3 people. Well, we still see that this will slow down the spread. It's an effective tool in slowing down the spread, but it's not going to be 100% effective. And of course, the problem with our vaccination strategy is that we're not evenly distributed. We have pockets of people who are unvaccinated. In fact, I think if you think to your own peer group and friends and family, you'll find that they're either all vaccinated or all unvaccinated. And of course, when we think about back to school concerns, we have groups of people who are under 12 who are completely unvaccinated. So that one person who might bring that into the school, well, that will spread incredibly rapid within the school. And those kids, once they're infected, will bring it back to their communities. Another reason that herd immunity is not currently possible, in our original estimates of how many people we would need to be vaccinated when we were dealing with the original strain of the virus, we thought maybe 60, 70% of the population. And you can see that if this were the case, we'd have our older adults who would be hitting that rate. Our younger people are nowhere near that rate at this point. Partially that's because, of course, we're not vaccinating people under 12, but partially it's because uptake in younger age groups is still quite low. Now, unfortunately, because of the mutations in the Delta variant, we need vaccination rates to effectively be 100%. And this is because after you've been vaccinated with the Delta variant, you will have the possibility of still carrying some of the virus. You may not have symptoms, you may not get seriously ill, and you will certainly carry less of the virus for a shorter period of time, but you may still be able to transmit that. So in this scenario, we've got one unvaccinated person in the top left corner who passes it on to their unvaccinated or their fully vaccinated friend, who passes it on to their friend. Maybe they don't even have symptoms. Well, this is a way of getting it into the school where, of course, that can easily be transmitted to 6 to 9 people very rapidly. And unfortunately, this person down in the bottom right-hand corner who's can't be or has chosen to not be vaccinated is now still at risk because those kids can bring this back to their fully vaccinated friends and neighbors and have a chain of transmission to them. So for individuals who've thought that low community rates or having all their friends and family around them vaccinate would protect them, I'm afraid that's no longer the case because you can pick up an infection from a fully vaccinated person. The next consideration that's fundamentally changed our understanding from the original variant to the Delta variant is how the virus is transmitted. In the early days, we really talked a lot about droplet transmission. We knew that if you were standing downstream of somebody who had sneezed, one of those sneeze droplet had more than enough viruses to infect you. And if you were standing a little bit further away, or maybe they were sort of breathing and singing instead of coughing and sneezing, there'd be less virus, but enough to infect you. And that's why we recommended that you stay 2 meters apart and obviously keep your masks on. This is still true in that you definitely don't want to be surrounded by someone who's coughing or sneezing or who has a symptomatic infection because they'll be shedding a lot of the virus. But what we now know is that the virus can live in little tiny aerosol droplets, and the Delta variant can be transmitted even with really passing contact with somebody. In fact, just breathing the same air is enough to get someone infected. The way I think it's best to think about aerosols is imagine there's a really bad smell. Someone smoked a cigar in a room you were in, or maybe you set something on fire in your kitchen and you were trying to clear the air so the smoke detector would go off. You can't just open a window and fan at these things. It takes a while for the air to clear. The more people in a room, the more aerosols are produced because every time we breathe out, we make some of these little humid particles that can carry the virus. One of the best strategies to reduce the amount of aerosols in a room would be to have fewer people. Unfortunately, I don't think any school district in Canada has really committed to reducing class sizes. But there are still ways that we can keep classrooms safer. Imagine again that burnt toast in your kitchen and you're trying to clear the air. Opening one window is not going to be sufficient. This preprint data that really looked at how to best keep aerosols out of our room said that you had to keep all the windows open all day, not just during break times, not before and after. The room should be the same temperature as the outdoors, and you should be able to feel a breeze, just as if you were trying to clear a bad smell from the room. Masks help. If we can keep our aerosols to ourselves, or we can trap those aerosols in our masks, then they'll stay out of the classroom. HEPA filters work, but not nearly as well as masks are keeping all the windows open all day. And of course, with all things SARS-CoV-2, adding up these little fixes has a big effect. So keeping the windows open, keeping those masks on, and keeping and using filters are great ways to reduce the number of aerosols in a classroom. Understanding that the majority of the spread of the Delta variant is through aerosols really does change our considerations for which masks are the right choice for us. In the early days of the pandemic, we would use the phrase, "My mask protects you, your mask protects me." And that was true when we were using surgical masks, which are designed to keep your droplets to yourself. Unfortunately, often with surgical masks, they don't have a really tight fit, so you end up breathing around the mask or breathing in air from outside. This unfortunately means that you'll be breathing in aerosols in the room around you. A better choice is an N95 mask. These masks are really tight so that you have to breathe through the mask, and they do protect from aerosols. However, they're not kid-sized and they can be uncomfortable to wear for a really long period of time. Most parents will probably decide that fabric masks are the right choice for them or their children. But again, these considerations are the same. You need to make sure that there are no gaps, so your child's breathing through the mask and not around it. You also need to make sure that there are multiple layers, at least 3, and one of them should be a polypropylene inner fabric layer, as that's been shown to be one of the best at filtering out these aerosols. Definitely don't use neck gaiters, bandanas, or fleece, because they've actually been shown to break up those droplets into smaller little aerosols, so not very helpful. As well, a lot of free masks have only one layer or very, very thin layers. If you can blow a candle out through your mask, it is not protecting you from breathing in aerosols. So you really want to make sure that you have to breathe through a mask of multiple layers. Let's not forget that lunchrooms and break times have been a major source of occupational transmission. We take our guard down, and obviously if we don't have our mask, we can be breathing in things from the outside air. So break time has been a frequent source of infections during this pandemic. How can we make these safer? Well, outdoors is always better than indoors. Keeping all those windows open to make sure that we have those air currents to reduce the aerosols. Reducing occupancy, fewer people means fewer aerosols. Increasing the distance from each other, and not eating face to face so that you're not actually sharing those big droplets. All of which, of course, are very challenging to do in a school system. One of the more upsetting things about the Delta variant is that in the original days of the pandemic, we would say that it was very, very rare for a kid to bring home the infection and infect the majority of their family. They really did seem to be somewhat resistant to the infection. We now know that kids can both get infected and they can transmit infections with the Delta variant. It may surprise you to see that, in fact, the majority of infections from the very beginning of this pandemic have been in younger adults or children. Young people tend to have a lot of social contacts, so school or work. The university age crowd often works in the service industry where they come in contact with a lot of people. And so actually infections are extremely common in younger people, including children. Fortunately, children don't end up in the hospital. But with the increase in the prevalence of the Delta variant, we have seen that 1,400 some odd infections in children have resulted in a hospitalization. And if we look to the American data, where we can see that over the course of all the waves of their infection, in fact, the number one reason for pediatric hospitalizations was COVID-19. And if you look on the very far right of the graph, you can see that with the Delta variant, there's been a rapid increase in pediatric hospitalizations, especially in young children. So we now know that children can get sick, they can have acute consequences that bring them to the hospital or to the doctor's office, and we now also know that they sometimes have long-term health consequences. For this reason, we all need to focus on protecting children from the effects of COVID. One of the things we can do is make sure that we don't have symptomatic kids going to school. But the problem with children is they often have weird and wonderful symptoms to any infection, let alone COVID. For example, we saw a big shift between the original version and one of the earlier variants to a lot of stomach aches, diarrhea, upset stomach. And we now see that they have a whole range of symptoms, everything from a mild runny nose to pain behind the eye to really mild fevers. And this, of course, makes it exceedingly difficult to ascertain whether the child has a COVID infection or another respiratory illness. Even more complicated is the fact is we are expecting quite a few respiratory illnesses this year. So if you look back to the very left of this chart here, the 35th week of the year is about the start of school. And last year, we actually had a pretty significant number of rhinovirus infections, which are common colds. They cause runny noses. And many of you will remember this time last year, a lot of kids had to go and get tested because they had a runny nose. Now, over the summer, these sort of decreased, but we started getting vaccinated and mingling again. And so now what we see is there are low levels of rhinoviruses and even influenza virus, respiratory syncytial virus, et cetera, in our communities. Once schools come together, some of these viruses will spread very quickly, and we can expect a very high peak of these infections, all of which have symptoms that really do mimic COVID. So what can we do to keep COVID out of our schools? Well, obviously screening for any symptoms, no matter how mild, before they get to school will be important. And if a child has any symptoms, it would be wonderful if public health agencies in your region would allow you to get them tested or at least wait till those symptoms have resolved. For two reasons. One, you wouldn't want to share COVID with anyone else. And two, the more runny noses we have in the school system, the more people who have to take time off to get tested. We really do worry about, oftentimes we will send a kid to school after they've taken a Tylenol or ibuprofen because they might have really minor symptoms and we might need them to go to school so we can go to work. Unfortunately, this can mask many of those symptoms. And so if a child is sick enough to need Tylenol or ibuprofen, they should not be going to school. Allergy medicine is another story, and if you're absolutely certain that your child has allergies and you want to give them medication, there's no reason why they shouldn't be able to come to school for that. However, we should expect a lot of absences in cold and flu season. We know that anytime there's a runny nose, there's a chance of COVID, and so it will be best to err on the side of caution. Obviously, keeping up with the mask, the distancing, the hand hygiene is very helpful, but one of the most important things we can do as adults is make sure every single eligible Canadian is vaccinated. Cutting down the rates of COVID in our community will stop it getting into our schools and will keep our children protected. Vaccination, you will have heard, has much drama associated with it, but the fact of the matter is, even if you have a small chance of transmitting the infection, it is an essential part of our toolkit to stop COVID in school. The majority of cases in Canada today are in unvaccinated individuals, as we can see on the left. And vaccination works incredibly well to stop you from getting hospitalized or getting sick. And so every Canadian who can be vaccinated needs to be vaccinated to protect those like our children who cannot. That's all I have for you today. I thank you so much for listening. I'm always thrilled when people reach out to me either by email or by Twitter or Instagram to let me know what questions they have or what they'd like to see on the next video. You can go to my website and download these slides. You're more than welcome to use them for any purposes that you wish. And I wish you all the best and luck in keeping our schools and our children safe in 2020.